Simulation is part of the process to receiving your radiation therapy treatment. This is the first step in the process after you have met with the doctor and have decided you want to proceed with radiation therapy. Here in simulation, we will take a CT scan of you in your treatment position so that our dosimetry team, along with your doctor, can begin the planning process of your treatment. Your treatment position will depend on the area of the body that we are planning on treating, and may use a variety of devices that will help us position you for treatment. Some devices, such as a VacLock, will hold its shape to the position we form around you so that we can ensure you are set up the same every day. Other devices, such as a mask, will be heated up and formed around your head in order to hold that position throughout the entire length of treatment. To further help with your setup, we will make reference marks on your skin that we can use our external laser system. The laser system is calibrated to line up the same both in our CT simulator and out on our treatment machines. This is done to ensure that we are able to accurately line you up down to the millimeter. In order to use these reference marks, we will place BBs over them, which will show up during the CT scan. To use these marks, we will need to place permanent tattoos on your skin. Depending on your treatment, we will typically give between 1 and 5 of these tattoos. The placement of these tattoos does not mean this is where you are receiving radiation. However, it is in a stable position for the therapist to line you up during treatment. During daily treatment, the therapy team will use the devices created during simulation, as well as using those tattoos in order to position you to the exact way you were. Using the laser system in the room, the therapist will adjust you to line up these tattoos. It is important to let them move you and not adjust, even if it feels like you are twisted. The typical tattoo mark used for radiation therapy are used with black ink and placed just under the surface of the skin using a needle. You may feel a slight poke as the therapist gives you these tattoos. These tattoos are very small and you may not even notice them when you're looking for them. However, know that the therapy team is able to find these marks. There's another type of tattoo that may be used, which is an ultraviolet tattoo. This is permanent just like the standard one. However, it will shine when using a special ultraviolet light. This allows the therapist to find the tattoo and align to it. One difference, however, is this type of tattoo may be completely invisible to the eye under normal light and only be seen with UV light. The therapy team will use the UV light to find the tattoo. They may make a dot on it with a washable marker, which allows them to align to the laser system. Because this mark is only visible under UV light, this washable mark allows the therapist to see it while using just the laser system and the normal lights in the room. This washable mark can be removed after treatment with either water or an alcohol wipe. To further assist with your daily setup, the therapy team may also place a Tegaderm, which is a breathable sticker, over the mark and tattoo. If this is placed, please check with your therapist before removing it. After receiving the tattoos, your body will begin to heal, and you may notice the area becomes red and itchy. It is important not to scratch these areas, especially while healing. You can bathe normally after receiving these tattoos, as they will not wash off. As with any tattoo, these tattoos may fade with time. UV tattoos typically will fade faster. If the UV tattoo fades during this time, it can lead to your treatment team having a difficult time finding it as well as accurately setting you up. Should this occur, there may be a need for the treatment team to tattoo you again, this time with a standard black ink. This will allow for the visibility of the mark and continued accuracy of your setup. The therapy team may try other ways to avoid re-tattooing you and may ask you to leave a Tegaderm on throughout your treatment covering that mark.